So here is another case that I did with dental bonding that I want to show you. This patient has something called gingival recession. And so her gums have receded. That's a pretty complex topic that we can talk about in other videos, but her issue was the gums have receded, and because of clenching and grinding, her root structure started to wear away over time. It's called an abfraction. So let's check out how we treated this. She has, if you can see on all these upper teeth, she's got recession, which is where this gum has pulled away from the enamel of the tooth, and then she has these little divots, as you could say, on the root surfaces. So the way we treated that was we were able to cover those areas with dental bonding, and you can see how nice this result looks. So what this is going to do for the patient is it protects the tooth, it gives it strength at the root area, it protects where that root exposure was, so when she goes and brushes her teeth, she's not going to erode away any more root structure. We put her in a night guard because clenching and grinding can cause issues with root recession. So with the bonding and the night guard, this is a great treatment for her, and that's going to last a long time for her, and it's going to keep her teeth nice and healthy. If you have teeth that look like that top picture and you have gum recession, come see us and we can see if dental bonding is an option for you.